Matt.
I'm Mary.
I'm Sherry.
I'm Randy.
Imagine this. Your baby was born with 6 to 8 broken bones and you had no idea what was wrong with them. The doctor walks in and tells you that your baby has osteogenesis imperfecta, which is also known as brittle bone disease, or I will be referring to it as OI. The OI Foundation states that a minimum of 20,000 people with a maximum of 50,000 people have OI just in the U.S. alone. This number may not sound large compared to the size of our population, but is a large number because it is affected by many families in our country. There are 3 main aspects of OI. The first one is the symptoms. The second aspect is the development, and the third aspect is the treatment of OI. Let's first talk about the symptoms and the various types of OI. The types and the symptoms were found on the OI Foundation website under Fast Facts. The site can be accessed at www.oif.org. The most severe type of OI is type 2. The symptoms are as follows. Frequently lethal, at or shortly after birth. The baby died because it had respiratory problems, numerous fractures, bone deformity, and improperly formed collagen. I'll explain collagen later. Here's a picture of type 2 OI with multiple bone breaks in the baby, which caused the respiratory problems, which sadly caused the baby to die. Type 3 is the second most severe type of OI. Type 3 has 100 fractures before puberty. They have short stature, which causes the person to have respiratory problems. The sclera is blue with a purple tint, which can be seen in this picture here. They have loose joints, poor muscles, scoliosis, which is curvature of the spine, a triangle face, severe bone deformity, brittle teeth, hearing loss, and also they have improperly formed collagen as well. Those are the 2 most severe types. The less severe types are type 4 and type 1. Let's first talk about type 4. Type 4 has all the same symptoms as type 3. The only difference is there's not as many fractures as type 3, and type 4 does not have severe bone deformity like type 3. Here's a few pictures. This is the first one. This shows a bowing in a child's arm. This can also be seen in the femur bones, the shin bones, and the upper bone of the arm. And like I showed before, the purple blue tint of the eye. These are I guess I forgot type 1. Type 1 is the most mild type and the most common type of OI in children. Typically, there's 20 to 40 fractures before puberty. They have the loose joints and the low muscle tones. The sclera has the blue-purple tint, triangular face, scoliosis, possibility of brittle teeth. The main difference is they have normal collagen, they just have less of it, which causes the deformities. These types and symptoms are first shown in the womb because of a mutating in the genes. So the second aspect of OI is the development of genes, in other words, where the person obtained the disease. Genes are the first cause of the development of the gene. So here I have made a little diagram. The P1 and the P2s show the parent 1 gene, the parent 2 gene. If the child obtains the parent 1 gene, there's a 0%, or if the parent has the gene, the child has a 0% chance of having the disease. But if parent 1 has OI and doesn't just carry the disease, they have a 50% chance of getting OI. And they have a 25% chance that they're just going to be a carrier. If both parents have the genes, there's a 75% chance that the child will inherit one or both genes. 25% that they'll inherit parent 1, and 25% that they'll inherit parent 2. If, in the case, they inherit both parents' genes, it's typically the outcome of lethal type 2 OI. If the child, 25% of OI children had parents with neither had genes of OI, which the result was the child had the new dominant mutation gene, which I will explain in a little bit. In this case, the child has a 50% chance of passing on OI to their children. Also retrieved from the Free Dictionary, which is where my diagram came from, is about 25% of children with OI are born into a family with no history of the disorder. This occurs when the gene spontaneously mutates in either the sperm or the egg before the child's conception. No triggers for this type of mutation are known. This is called the new dominant mutation. Abnormal or unorganized collagen is another result of development of OI. Retrieved also from the Free Dictionary on March 4th, 2011. Collagen is a fibrous protein material. It serves as the structural foundation of skin, bone, cartilage, and ligaments. In osteogenesis imperfecta, the collagen produces abnormal and disorganized. This results in a number of abnormalities in the body which causes the fragile bones. If the genes are abnormal, like I discussed, this will cause types 2, 3, and 4. The only way that you can get type 1 is if your collagen is abnormal. If a child is born with OI, the parent needs to learn how to treat it. So the third aspect is the treatments of OI. Authors Monte, Motz, and Pascini, in their article Current and Emerging Treatments for the Management of OI in the Dove Press in August 2010, stated that there are 3 types of treatment available for OI: non-surgical, surgical, and medical treatment. So one way you can treat OI is with the surgical or non-surgical treatments. The first is physical therapy, and now this is not just something for people with OI. Anyone with broken bones goes through physical therapy. OI patients just go through physical therapy more often than the normal human because they have more fractures than we do. Plotkin, author of Genetics of Osteogenesis Imperfecta Treatments and Medications, which I referenced on March 2nd, 2010 on emedicine.com, in patients with bowed, long legs, intramedullary rod placement may improve weight bearing, and this will enable the child to walk at an earlier stage, which is this picture right here. This shows one leg is bowed on the right, and on the left there is a rod placed in the bone in order to keep it from bowing or keep it from breaking. Medicine treatments are also another way that people with OI are treated. One way is to take medicines that help strengthen their bones. So in order to help strengthen their bones, it will also keep them away from bone breaks. The next medicine treatment that is most common is a growth hormone. Growth hormones help the child grow because short stature is very common in all types. So now I've talked about all the aspects of OI. The symptoms, which is the first aspect. The second aspect is the development, and the third aspect is the treatments. So even though you may not know anyone with OI, now you've learned a little bit of fast facts about OI that may help you in the future.